The ease with which the Indian variant of COVID-19 is spreading in Victoria is the highest concern of authorities tonight, with 4 cases linked to what's been dubbed fleeting contact. Officials are meeting tonight to discuss options, with an extension to the current lockdown beyond Thursday night looking increasingly likely. Victoria's outbreak has grown to 54 after 3 new cases emerged today. 4,800 primary contacts are being monitored. So far, 3/4 of them have tested negative. And there's been a slight dip in testing. Close to 43,000 Victorians got a test in the past 24 hours. Vaccine uptake, though, spiked with more than 20,000 doses administered. State political reporter Richard Willingham begins our coverage.
Red sky in the morning, shepherd's warning. The Victorian flock hoping for better news. Just 3 new cases have been detected, but it's how some people are picking up this Indian variant that has authorities sweating.
Where we have seen transmission in these cases with very fleeting contact.
2 of today's cases are primary contacts already isolating. The other is a person not known to any case, but is suspected to have caught the virus in Port Melbourne near a known cluster.
This is stranger-to-stranger transmission.
54 cases are linked back to the Adelaide hotel quarantine breach. Half are part of the City of Whittlesea cluster in Melbourne's north. 1 man from that cluster spread it to 22 others in Port Melbourne, including one of today's cases who never entered the workplace but lived around the corner. And 4 people linked to aged care are positive out of almost 280 tests. Authorities are trying to work out how far and wide the outbreak has spread to determine if the lockdown can end on Thursday night. More than 4,800 people are primary contacts. Most have tested negative.
We've seen this outbreak continue to morph, as all outbreaks do. What we're now doing is we're keen to start to drain the swamp that says, well, what else is out there?
If you have visited any of these high-risk shopping areas across Melbourne, authorities want you to come forward for testing, even if you don't have symptoms. But it's the aged care workers who will now take priority. The state government will run a 5-day vaccination blitz. Aged care and disability workers will be able to walk into a vaccination hub and move to the top of the queue. It's a direct challenge to the Morrison government.
We have concerns that there isn't enough coverage. So that's very much why we're stepping in. This is very much a call to arms of those workers who are on the front line.
So where does this leave us? The big question everybody wants to know is, will lockdown end on Thursday night? The state says it simply doesn't know because it's still assessing all the case data. Officials will meet tonight and tomorrow to assess the state of play before hopefully making a final call.
It continues to be a day-by-day, case-by-case proposition. We are finely balanced. This is a significant and very concerning outbreak.
People that are really hurting, they need to understand if we're coming out. It's just not fair.
And that is all dependent on the numbers. Richard Willingham, ABC News, Melbourne.
The state government's move to have aged care and disability workers bumped to the front of vaccination queues has been welcomed, but a health workers union says the scheme needs more detail and extra effort from the Commonwealth. Mary Gearan reports.
Peter Sorkia is keen to see her elderly mother again face to face.
My sister and I ring her daily and we're just gauging her mental health at the moment.
91-year-old Mary Delilah is at Arcare Maidstone, the site where 2 workers tested positive. Peter welcomes the move to fast-track jabs for those who care for people like her mum.
They should be number 1 on the list.
They're a bit late, way late.
The Health Workers Union says aged care and disability staff should have been prioritised back in March, and it questions the use of mass vaccination sites rather than their workplaces.
How are they going to leave work to go and do that when the managers are saying we're short-staffed and we need you at work?
Today's good news, no further cases in aged care. But concern remains about staff working across sites, as they have been at Arcare Maidstone and other privately run facilities.
So that was surprising to me. It's a bit disappointing.
The Health Workers Union says the situation is even more dire. It claims workers isolating while waiting for COVID test results are being encouraged to come in for shifts.
The workers are scared and fearful because they have been told you will be terminated from the workforce if you do not attend your premises.
For its part, Arcare unequivocally says claims any of its workers have been pressured this way are not correct, and said to ensure staff work at just one site, it agrees to compensate workers for any income they forego as a result of lost shifts elsewhere, using the Commonwealth payments made available last week.
Both the Health Workers Union and Nurses Union oppose mandatory vaccination, saying vaccine-hesitant workers would leave an already overstretched workforce. But no matter what, medical experts say the vaccination rate in that workforce must jump urgently as the only way to ultimately protect the aged and the vulnerable.
The government will be hoping workers will heed the call sooner rather than later. Mary Guerin, ABC News, Melbourne.
Regional Victorian businesses are pleading to be left out of the lockdown if an extension is needed. But the police union is against the idea of another so-called ring of steel arrangement, saying it was inefficient and ineffective the first time. State political reporter Bridget Rollison has more.
Lockdown life can often feel a little bit robotic. For this Geelong education technology company, it's been particularly tough. Sales have pushed down, and without government assistance, they say they've fallen through the cracks.
Last year I didn't take a salary. Last year I made sure that all my staff remained employed, and I had to put personal capital into the business to keep it afloat because of COVID.
More than 300 kilometres away in Albury, single mum Jacinta Christians has a clothes store on either side of the border. One is closed.
I am having second thoughts about having a business in Wodonga.
She estimates the lockdowns have cost her business around $100,000.
I still don't understand why regional Victoria have to close when we've got no COVID cases, and we haven't had any COVID cases here for close to a year.
While many regional Victorian traders are pushing for the Ring of Steel to be reinstated, the police union has warned against the idea, preferring roving mobile patrols.
On our members' advice, what was done last time was, ineffective but also inefficient. It sucked up an incredible amount of police resources at the time, and it wasn't exactly foolproof either.
The state government says it still hasn't made a call.
It's too early to predict. We've still got, particularly at Axedale and Kahuna, a number of people in quarantining. And they might well turn positive. Let's hope not.
We're looking at the numbers. If we can keep it in the sort of single digits, then it is possible we'll come out of lockdown. But the fact that it's got into aged care is a real setback for everybody.
As vaccination numbers continue to climb, some experts are urging the state government to take that into account when deciding future restrictions.
The other thing we have to start considering, of course, is having different rules for people who are fully vaccinated. Why shouldn't someone who's fully vaccinated be allowed to cross over into New South Wales? They're very, very low risk.
Food for thought as winter begins. Bridget Rollison, ABC News.